Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMS a fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Lady brings her baby into the ER with a rectal temp of 103. Kid's tacky as hell and looks like shit. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital and that she recovered medication herself, for epidural, etc. Doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't or wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back, patient provided improper specimen. Optometrist here. Patient booked in for an emergency appointment, with a raging red eye. Clearly very painful, look under the microscope and the cornea is really not happy, wobbly reflexes, haziness, the works. Me, what happened? Patient, it's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue, so I used the same dye for both to match the color. Me, does that hair dye contain ammonia, by any chance? Patient, I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me, unless you can convince then to change the color scheme to red, no. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later came back for the referral. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members, because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large, red and white tent in the middle of the day. It was then that the elderly relative admitted to having spent the last 3 years driving from memory. Not a personal experience, but one from a colleague of mine, I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without formal warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker. That should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis, or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it just like that, me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night, at 7 p.m. on the couch. Whoa TMI, I just need to know approximate time to know if Plan B will work. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me, no sir. There isn't anything you can take now. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full southern breakfast. She damn near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA, the parents did in fact feel justified and hard done by, although a fake they didn't express anger at my brother. Knowing him, they didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. My wife used to work at an urgent care in an undereducated community. I guess most of her patients would have you wondering how they made it to adulthood. Some notable patients, the guy who, after learning he had diabetes, vowed to make a life change and replace all his soda with Gatorade. Women who don't know anything about vaginas or menstrual cycles. The people who come in with a history of heart attacks and chest pain that feels like a heart attack, but I know my body and it's not a heart attack. It was always a heart attack. Guys with grow sticks, hygiene related. People who did their own research. The parents who didn't get their, normally not complaining, teenage daughter medical attention when she was screaming in pain. After finding out she had appendicitis, they took her home instead of taking her to the ER. Her appendix ruptured that night. Bonus, my kid was in the hospital and sharing a room with another patient. This kid was morbidly obese and was elbow deep in a family-sized bag of potato chips. The doctor came in and really gave it to the mom. Your kid has kidney failure and is not supposed to be eating salty foods. Your kid has a major condition and you've missed the majority of his appointments.